As the Quackery and Malpractice Committee, our mission is to raise awareness about unethical practices in healthcare and beyond. Practices that often go unnoticed but have serious consequences for public trust, safety, and well being. From identifying unlicensed practitioners to highlighting gaps in institutional oversight, we aim to spark critical conversations and drive youth led initiatives that promote accountability, education, and ethical reform. We believe that when systems fail, communities suffer, and that awareness is the first step towards prevention. At first glance, national security may seem like an issue for policymakers, defense strategists, or intelligence officers. But the truth is, national security does not begin on our borders. It begins in our homes, in our clinics, our classrooms, and our communities. It begins when institutions function with integrity and when citizens are protected not just by laws but by the values. The rise of quackery and unchecked malpractice is not just a health concern, it is a national concern. When trust is broken in systems meant to heal and serve, the entire
Entire so
social fabric begins to weaken. And in the long run, no nation can be secure if its people feel unprotected, unheard, or misled. This webinar is our effort to support these quieter but deeply damaging threats to explore how the erosion of institutional accountability, public awareness, and ethical responsibility directly impacts our collective safety and well-being. Um, um, Now, to officially open our session, I would like to invite someone whose leadership continues to guide and empower youth led initiatives under Pakistan Health Parliament K chapter. Please join me in welcoming our president, Ms. Aanghshay Khan, to share a few words and introduce the mission that drives our work. Over to you, Aanghshay.
Thank you so much, Yushe, for such a wonderful introduction. Am I audible?
Yes, Aanghshay.
Okay, first of all, Assalamu alaikum and very good evening to all of you, to all the participants here, and to all the respectable guests here, Miss Sadia Bashir, Mr. Colonel Jahzeb Khanyazi, and Sir Aftab Ahmed Khan. It's a truly an honor and a delight for us to have such a competitive panel of speakers today with us for this particular seminar. Before we begin, I just want to give a brief introduction of how our chapter has been working lately. It was a dream that was um, held by a girl who thought that it would be impossible to spread to such a big level and to have such a creative audience and to have such a respectable panel of guests for our sessions in the coming time. And this all has been possible because of the consistent effort of my team. My team at K chapter has been consistently contributing towards the well-being of youth, empowering them and making them aware about the ideal healthcare standards. As far as our progress is concerned and real time implementation is concerned, we have had a fair share of contribution in spreading awareness regarding the healthcare related problems among the youth, which is really very important. And the panel that we have today is one of the most reputed and respected people who can who can join us to enlighten our youth that what actually a national security means when it comes to home and how it has been impacting the people around and how youth can play a very cardinal role in spreading the message and in actually manifesting their role as the leaders of this coming era. So thank you so much everyone for joining us. I hope you will have a really insightful session with all the speakers. And with Sir Aftab being on board, he is also one of the president of the health chapter that is going on in Karachi, I believe. And we are delighted to have you on board, sir. I hope you would have a very wonderful experience while giving this insightful session. Along with that, I want to extend my warm greetings to Sir Jahanzeb, who is a retired officer of the Pakistan Army with an exceptional and multifaceted career. It's very heartwarming to see that our armed forces and the professional from the armed forces are committed on such a great level to empower their youth, to enlighten their youth, and to navigate their youth through major issues that have been pertaining in our society. And along with that, I wholeheartedly welcome Ms. Sadia Bashir, who is the Deputy Director at 𝐸𝐼MA, and she leads educational policy, governance, and school reforms. Ma'am, it's an honor to have you here with such an exceptional panel and the exemplary leadership of my Chief Secretary, 𝐸𝐡𝐫𝐞𝐳 Hassan Khan. I hope that this panel would make a great success. And with that, 𝐸𝐡𝐫𝐞𝐳, you may proceed. Over to you.
Thank you for your kind words, Aanghshay. We are fortunate to be joined today by speakers who bring diverse experiences from education, the armed forces, healthcare, and policymaking. Each one of them has not only witnessed institutional gaps firsthand, but has also worked tirelessly to address them to create solutions rooted in ethics, awareness, and reform. Whether you are here as a student, a professional, or concerned citizen, your presence today matters because real change begins when we ask questions and, more importantly, when we are willing to listen to the answers. Thank you once again for being with us this evening. Now, I have great honor of introducing these exceptional individuals. Each one brings a unique perspective and an unwavering dedication to public service. Our first speaker this evening is someone who bridges the worlds of academia, literature, and public policy with remarkable depth, Dr. Sadia Bashir. She is a renowned educationist, poet, and public intellectual who brings over 20 years of experience to Pakistan academic and administrative landscape. She currently serves as the Deputy Director at the Punjab Education Initiative Management Authority, where she plays a vital role in shaping educational reform across the province. With a PhD in Urdu literature and academic degrees in education and regional languages, her work combines cultural insight with practical policy making. Dr. Sadia has written extensively on issues of gender, ethics, and identity, and continues to use her platform to promote civic responsibility, educational equity, and national cohesion. It's an honor to have her with us today. Our next speaker is a leader whose career spans national defense, corporate leadership, and youth empowerment. Lieutenant Colonel Jahanzeb Khan Niazi is a retired officer of Pakistan Army with a decorated and multifaceted career. He has served in key internal security and administrative roles, including as the wing commander in Pakistan Rangers Sindh and officer commanding of military force unit in Karachi, where he oversaw high security zones like Jinnah International Airport. After the retirement, he transitioned into the corporate sector where he led major textile operations in partnership with brands like Nike, Hugo Boss, and Levi's, with a strong focus on ethics, sustainability, and compliance. He now continues to mentor young professionals through leadership programs and serves as country head for Odisha Learnings, USA and Pakistan. From the military to management, Colonel Niazi's experience speaks volumes about discipline, system thinking, and integrity. We are privileged to have him here with us. Our third speaker brings a vital voice from the front lines of healthcare and public advocacy, Dr. Aftab Ahmed Khan. He's a seasoned public health expert, family physician, and policy advisor who currently serves as the president of Pakistan Health Parliament, Karachi Chapter. He is also a consultant at Meet Hi Zindagi Pakistan, where he champions patient-centered care and institutional reform. His career spans leading organizations such as Aga Khan University Hospital, UNICEF, WHO, CDC Atlanta, and more. Blending global experience with grassroots commitment. In addition to his policy work, Dr. Aftab has also appeared regularly on national media platforms where he demystifies healthcare challenges for the public and advocates for accountability, ethics, and trust in the medical practice. We are deeply honored to have him lend his voice to this discussion today. Thank you once again to all our speakers for being here with us. To commence today's session, it's an honor to invite Dr. Aftab Ahmed Khan, who will be delivering a focused presentation on the institutional gaps that enable malpractice and how they ultimately threaten national security. My team will be sharing his slides on the screen as he presents. Dr. Aftab, over to you.
First of all, thank you very much for inviting me for such an important topic today. And it's a need of the day that we have to talk about the quackery and the malpractices. Although it's related to my profession, medical, but there are certain other fields, is medical allied fields also. So it's a good topic today we can talk about, and we, as you just introduce other speakers, learned speakers. So it would be a good show today to learn with each other, and for the audience who are just also with us to learn how we can just combat with this malpractices and the quackery in our country. So first of all, I just would like to have a few slides on that. I just try to chalk down this some questions arising in the mind of different people over there. So I just try to address all these things. So this is a brief introduce. Thank you very much. And next slide, please. Okay, I'm just starting this thing, and in between you can go for the slide mode so everybody can see clearly over here. So there, as a public health scientist, because I'm a public health consultant and a scientist also, there is a question arise that in a country, what risks when the public health policies are not strong or properly followed? Because the public health policies are the backbone of every country or every health system in different countries. So if this is not up to the date, how we can just combat, or what risks we can just observe in this case. So without the strong and the well enforced public health policies, a country faces the numerous risks, which includes the proliferation of the infectious diseases. Like in Pakistan, we can just recently have a COVID, we have a polio. We are not controlling the polio right now, and we have tuberculosis in Pakistan. We have some other infectious diseases which are nowadays very prevailing in our country, and we are trying to combat all these with different immunization or vaccination, but not succeed because the public health policies are not up to the mark. That's why we are just seeing these type of problems over here in Pakistan. For the audience who just can speak Urdu and English, I just my presentation would be in the bilingual so everybody can understand easily. होता क्या है कि जब पब्लिक हेल्थ पॉलिसी, पब्लिक हेल्थ क्या होती है? पब्लिक हेल्थ बेसिकली जितनी पॉलिसीज हैं गवर्नमेंट की, उनको हेल्थ पॉलिसीज को जो है वो सपोर्ट करती है कि हाउ वी कैन कम्बेट ऑन दैट। एंड हम चाहते हैं कि जी बीमारी होने से पहले ही जो है वो मरीज की बीमारी को ख़त्म कर दिया जाए, और पब्लिक हेल्थ का यही इशू होता है, प्रिवेंशन बेटर देन क्योर, कि हम अगर पहले से जो है प्रिवेंशन कर लें तो हम बच सकते हैं। तो हम यही चाहते हैं इस पब्लिक हेल्थ के हवाले से कि ऐसी पॉलिसीज बने ये इन्फेक्शियस डिजीज हैं बाय वैक्सीनेशन और बाय इम्यूनाइजेशन उसको हम रोक सकें। जैसे हमने रिसेंटली देखा कोविड एक पूरी दुनिया का जो बड़ा इशू था, फिर वैक्सीनेशन हुई और उसके कंसिक्वेंसेस भी हमने बर्दाश्त किए। इसी तरह पोलियो ड्रॉप्स हर साल पाकिस्तान में देखें, पोलियो 2 कंट्रीज हैं दुनिया में पोलियो तो कंट्रोल नहीं हो रहा, वो भी इन्फेक्शियस डिजीज है। और इसी तरह से टाइफाइड है और बहुत सारी बीमारियाँ हैं जो एक दूसरे से लगती हैं। तो हमें चाहिए कि उनकी हम बेटर पॉलिसी बनाएं और इससे हम बच सकें। और इसी तरह से जितनी जो मैल प्रैक्टिस जब होती हैं, जब ज़्यादा बीमारियां होती हैं तो इतने ही ज़्यादा जो लोग हैं वो मार्केट में आ जाते हैं और उससे नुकसान ज़्यादा होते हैं। तो हम चाहते हैं कि इस चीज़ से बचा जाए। इसी तरह से एडिशनली अगर हमें बात करें तो इकोनॉमी कैन सफर ड्यू टू द इंक्रीज हेल्थ केयर कॉस्ट, reduces the workforce productivity and potential loss of the international reputation. इसमें भी यही होता है कि अगर खुदा ना खास्ता कोई, जैसे देखा जाए हमारे यहाँ पर क्योंकि हेल्थ सिस्टम इतना इस्टेब्लिश नहीं है, तो जो बर्डन है वो जो हेल्थ केयर सिस्टम पे बहुत ज्यादा है।